The body is a very complex matrix of systems which work individually and collectively. When you get sick and experience some symptoms, how does your doctor tell what is wrong, considering that the body is fully covered with the skin? By looking at the symptoms. The same symptom in one person can mean a different illness in another person. This is the dilemma that is facing health practitioners every day. The headache of diagnosis. In this show, we present you with a medical intuitive who transcends the barriers of diagnosis and treatment and make this look so easy. Watch the show and be amazed.
I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses.
I think according to into yabo research yabo ayikho treatment for lead disease.
This is a God-given gift which is coupled with my training and acumen for physiology and anatomy. Over the years, I've successfully diagnosed and treated illnesses that have defied even the best of some of the medical practices. We all have our life purpose, and this one is mine. Welcome to Dr. Alternative Show. It's good to be back again, and thank you for getting so many wonderful comments and suggestions and questions, and even for your prayers. And this one?
Greetings to the viewers. Tembi, thank you for having me on the show.
You're welcome. We know of some people that have got a growth somewhere in the body. In some cases, you will find that it actually runs in the family. And you can hear people saying, abantu bala family bayathandwa ngamaqhuma, meaning people that belong to that family have got a growth somewhere in their bodies. What are these tumors? Are they only localized on the outside of the body? Should you be worried if you have them? In our show today, I will be presenting a condition that gives rise to these tumors. But as usual, I have prepared a clip for you which will give more clarity on the condition. And the condition is called MEN, M-E-N. Umen lo upela amadoda. But it doesn't actually mean, it's abbreviation of a condition which is called multiple endocrine neoplasia. Multiple endocrine neoplasia. Please take a look at the clip. We are made from cells which are produced, get used, and die through a well-structured and orchestrated process. Every cell should follow this production, use, and death process within its time frame. There is a gene that regulates this and the pace of production. Once this gene is defective, the process becomes too fast and causes growth or tumors. The condition where this occurs is called multiple endocrine neoplasia, abbreviated MEN. MEN affects the endocrine system. This is a system of hormone-producing glands that regulate the entire body functioning. There are different types, but they all still target the endocrine system. MEN affects all ages, from children right through to adulthood. Symptoms range from vision problems, overactive thyroid, enlarged adrenal glands, enlarged pancreas, infertility, the list goes on. So, if you tend to get too tired, or you have persistent abdominal pains, your back is aching, or you can't have children, the culprit may very well be men. Welcome back. I hope that has given some clarity on this condition, and we will talk more about it as we go along. And as usual, I will make reference to cases that I have treated where these conditions have prevailed. I want to stress something in this show again. I don't talk or present a show about any condition where I have not had the experience of diagnosing and treating it. So even with this one, I'm presenting it because I have had a few cases that have got a condition, that have got this condition, and different age groups. Okay.
Okay, so Thembi, you are known for detecting illnesses that are quite difficult, in fact, so difficult to be diagnosed by other practitioners. You know, Abo can't get, so as to speak that term. Now, how do you get this right? And I'm sure that is a question that baffles a lot of people. How do you get this right?
As I've indicated that if I talk about an illness, you must rest assured I have diagnosed it before and I have treated it. So coming to your question, how do I get this right? How do I get this right indeed? I would say it's a combination of my knowledge and training on physiology and anatomy, because I touch on conventional medical side, but then it's also my gift. What makes me more prominent and more able to achieve what I achieve, both in terms of diagnosis and treatment, is my intuitive gift, my gift of intuition. Because when a person walks into the room, people already know that when a person walks into my rooms, I don't see them. I don't see them. They go to the consultant and they get scanned there. And what the consultant sends to me is a picture, because they take a picture of what presents in the scan. It is that picture that I analyze. And that picture presents to me what the problem is. It presents to me, it doesn't present the whole body. It presents all the organs or the systems that have got problems. It will not present a brain if there's no problem with the brain. It only presents it when there is a problem with that particular organ.
Okay.
But I'm in a position to see what is actual. I will be able to pick up. I mean, some people look at it and they ask, once I've given them all the results, they say, I mean you tell me all that you are telling me from Lela Kweb, from Leand, because remember, some of them even take the pictures. So you mean you're telling me all that you are telling me, which I know I can relate to, from Lela Kweb. That Kwebu that they are referring to, that's my X-ray. That's my results of and if I were to say conventional, that's my CT scan, that's my MRI, that's my X-ray, that's my everything, that's my ultrasound, combined into one. Because this tool that I'm using, it combines all of them and goes beyond.
When you say it combines all of them, what do you mean?
I mean, it would do better than what an MRI scan would do. It would
so
do
it combines
better.
all the scans.
All the scans and the blood tests. Because remember, conventional would do a blood test, a particular blood, or maybe send you to an ultrasound if it's abdominal, or CT scan. But for me, it combines all of that and goes beyond and presents what is actually happening. So that's how I get it right. That's how I get it right. I cannot even explain in standard or usual terms, because remember, this is intuition. For me, I see it very clearly. I see the body. I see what's happening, and this is what makes me to not move. Even in situations where you find a person has already got a diagnosis or has got a report from his or her doctor or oncologist or whatever, I will not move. I will not shift one thing. I can even make a reference to one case that I saw recently in Johannesburg, where this girl was diagnosed with osteosarcoma, which is a cancer of the bones, of the skeletal system. Okay, but now when she came, she did write cancer in her form. Most people don't write; they just leave it blank so that I must be the able one to tell them. So for them to prove that I really know what. But she did write cancer. So when she walks in, and she was with her relative, and I said, okay, I've done my scan, but now that you've made reference to cancer, what cancer do you know you have or you have been diagnosed with? And then she said, no, I'm not going to tell you. You're the one that must tell you what cancer you discovered. Me, I know, because I already know. I mean, I've been told. But you tell me, I'm not going to tell you. I said, okay, no problem. The fact that she said she had osteosarcoma was only after I had given her my results. And she had what we call lymphoblastic leukemia, according to me. It was not osteosarcoma, it was still cancer, but it was lymphoblastic leukemia. And she didn't buy into that. Because remember, for years, she has been told she has got osteosarcoma and has been treated, was on chemo for that. So we had a bit of discussion. And I mean, I could see that she's not buying into, but now these are the areas that, the things that she shared. She said, firstly, the metastasis of the cancer, meaning the growth, because cancer will start somewhere and then it ends up growing into other organs or other systems. But now the metastasis of this cancer, in her case, caused her to have a lung a problem. So she said they removed a piece in the lung. Then I asked her, what is the connection between the bone and the lung? She said, no, she was defending her oncologist. She said, no, I've done the research and I know that osteosarcoma can cause lung problems. I said, okay. And then also she said, as it progressed, then she had it affected the breast. And I said, where's the connection even there? She said, they said it was, her oncologist said it was, they don't know where it is originating from.
Which part?
That is now the cancer itself.
Okay.
Yeah, because like I said, metastasis has got an original area where it starts, and then it ends up affecting other organs or other systems. So, but now she says, the doctor said because why she was saying, because she said it seemed to be mushrooming in a number of places. It would be there, and then they chased this, and then it would be there, and then they said they know it's somewhere, but they don't know where it's originated. That they would not waste time or maybe money trying to find where. They would just try and chase these areas where it seems to be. And then I said, let's go to lymphoblastic leukemia. Lymphoblastic leukemia is a bone marrow cancer. Lymphoma is the cancer of the lymphatic system. The leukemia is the cancer of the blood. Okay, but they both come from the bone marrow, so they do affect the bone. But it's not osteosarcoma, because sarcoma is the tissue, bone tissue. Okay, so I said they do affect the bone. In what way? Because both these type of cells come from the bone marrow. So you find that I even gave an example of someone who never knew that she had, but it was just leukemia in that person. And then she was making up her bed, and she was an oldish person, making up her bed, and then she slipped. And then she fell. But after falling, she just could not get up. such that the ambulance had to come and take her to hospital. And then when they took her to hospital, they took an x-ray. This was just from moving around making the bed. When they did an x-ray, they found that the bone had small cracks. It didn't break. It was because, you know, when a bone has lost its density, that it will not, it will just crack right around. So she had those kind of cracks, which concerned them. So they took her for further tests, because that x-ray was really concerning how a bone could look like that, meaning it had no density whatsoever. Then they found that she had a very advanced form of leukemia, and that's what had eaten the bone. Because leukemia originates from the bone marrow, from the red blood cells. But now lymphoblastic is a combination of both the white blood cells and the red blood cells, because they all belong to the same home. Your platelets, your white blood cells, and your red blood cells. So in her case, it started with the white blood cells, and they ended up affecting the red blood cells. So that's why she had lymphoblastic leukemia. But then I said, do you know where the lung and the breast is coming from? The lung comes from the spleen, because red blood cells get filtered and recycled in the spleen. You know, the spleen is the neighbor of the lung. Okay, you'll find people who have spleen problems, but then they might have respiratory problems or chest problems because they are in the same vicinity. Okay, so I said in my explanation, it's coming from the spleen. Okay, so that's where the connection of the lung. And then I said the breast, people that have got lymphoma, because it's a system that collects and dumps. So those, they dump in the groin, they dump in the abdominal, and they dump under the armpits. So you might have people saying, "Namakuma akula phansi kwamakhwapha," because those lymph nodes, they swell up, and the breast duct connects to your armpits. Okay. So I said that's where the breast was coming from. And the fact that they were saying this cancer seems to be going all over, because I said lymph and the blood, they're all over, because they service the whole body. So that's where, that was my diagnosis. So what I'm getting at is that my diagnosis, or the way I see so deep, it baffles me too sometimes. When we come back after the break, we'll talk more about this.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
Welcome back. We're talking about a condition called MEN. But I think for the interest of people understanding how I work, I actually like the question that Andrew has asked me, because it gives an indication of how far my intuition and my intuitive abilities go. So that in a nutshell, so even with men, therefore, with this condition, the person walks in and I could actually already see. But the other thing is, I have done extensive learning on the body. Okay, my extensive learning is not just limited to what a particular book will carry or particular material will have. Me, I study the body in depth, but I study it a single-handed, as a single system, but also as a collective system, as an individual system and also as a collective. So over the years that I've worked, I've gained extensive experience, but I'm also intuitively guided. So my intuition will just guide me to go and learn about a particular condition. But I tap a lot on the conventional medicine also because that information has been researched. It's not like what is out there is not valid. That info, like men, that condition has been documented by conventional researchers, by scientists. It doesn't mean it doesn't exist, but it doesn't mean it is the, because where do they get it from? They get it from working, but they also get it from being guided too. Because, I mean, who knows how the body operates? Who decided what condition should mean what? Who guides the body? It's not a man thing, it's a divine thing. So all the information that they've got, that they've documented, is there for use. But it's just a question of knowing how do you tap on that, okay? So which is my advantage? Because me, I'm in a position to tap on all that information through my intuitive abilities and guidance. So all that information that is sitting out there, which in most cases is not used or is unknown, me, I'm in a position to go and draw that file, go to that archive intuitively and get to know about a condition and use it as it is necessary.
Okay. So you're talking about documenting, etc., which I think you were referring to conventional, if I'm correct.
Yes.
That is something that doesn't seem to be quite known within the alternative sector. And with all the conditions and the illnesses that you're discovering, I'm just curious, what's your take with regards to that?
You mean with regards to the fact that, well, let me put it this way, that alternative practitioners have got the type of wisdom and information that would shock people. I promise you, if people were to be exposed to the level of wisdom that alternative practitioners have got, I'm not saying education, I'm separating, because education, that's formalized way of getting information and structuring it and documenting it. I'm talking about the wisdom. Wisdom is not limited to education, because your education comes from so far than just that professor. Okay, so alternative medicine has got the level of wisdom and information that would baffle people.
But tell me, when you say wisdom, are you referring to the wisdom of health?
Yes, I'm talking about health. In this case, I'm talking about health, but there's a lot of wisdom outside that context. But I'm talking, the context in this case is health. There's a lot of wisdom. There's a lot of wisdom. But it's not documented. Because remember, those people from the alternative, they don't have, and they don't maybe even need, maybe they don't need to document and write all these papers, and they don't need that, because it's in them, it's here, it's inside, it's so, and they just apply it. They don't need to road learn and study that and what have you. But then it's not fair for the transference of information down from generation to generation, which is what even people ask me all the time is, are you training anybody? Who is going to, because people are already concerned, hey, having someone like you, what happens when you go, when you die, when you get old and you cannot function? Who's going to take over? Because we want to make sure this continues. That's not my call. That is really not my call. But at the same time, maybe it is my call, because compared to some other alternative practitioners, I am educated. Okay, there are practitioners that you cannot even write their names, but who know so much. Okay, I know that, for instance, in America, there's a doctor, Dr. Noam Shelley, who, when he identified the level of wisdom, what I'm actually talking about, that he decided to put it into, to document it, exactly what I'm talking about, and create a curriculum so that people would be able to say, I'm picking up a problem here, but then they know it's the spleen. They mustn't just say it's here and it will cause, that type of thing. So that at least they try to meet the requirements, particularly of recognition and credibility, because once people pass that, then you find they are certified, then they can even claim from the national insurance. We don't have that in South Africa. But I have seen the need for that. But I don't know if, because it's a lot of work. Remember, to actually do those researches and documents and whatever, it costs time, it costs money, but conventional medicine or scientists are sponsored. You know, there's big companies, pharmaceutical companies who've got funds. They finance these researches, but with us, it's not the case. So that's why you find it's a problem. But then we're not really worried, because at any rate, who controls this line? It's God. It's divine. So we don't have to be worried or anxious about anything. He will put together things that need, or systems that need to be put together so that it continues, just like he has appointed me. Because people say, hey, who are you? Where are you from? I mean, me, I never knew. I'm me, you know. So all I'm saying is, maybe it's not our call to worry about formalizing this, but there's a lot of information that I've picked up in my line of duty where I feel, hey, if I were to write papers, I would also be in a position to say, this is what is happening.
Okay. Do you think you would ever get to that stage, though?
No, not in this time, not now. I mean, I'm bombarded with so much work. I don't even have the interest to look into that. But I have seen on a number of cases where I see that, gee, according to the information that is out there, this is what should be the case, or this is what they say. They say it affects this type of people. And me, I would find, no, it actually does so much more than what has been documented. But then they say you cannot claim if you have not done research. I'm just thinking of one, if I may try and run, just to give an. There is a client of mine that I treated who was diagnosed with lung fibrosis. Okay. And she was already on oxygen and had been told that you cannot reverse lung fibrosis. I mean, because the lung tissues, they get scarred. So you find the contraction and relaxation becomes a problem. Okay. So that was her fate, according to her doctor, a pulmonologist. But when she came to me, I discovered that it was, of course, the lungs were affected because the heart was the culprit. Okay, the heart, she had a hyperplasia of the myocardium. That is the cover, the tissue that covers the heart. Okay, but now, and that is something that I've had also, because hyperplasia, that is the tissue swelling that occurs as a result of abnormal cell production, which eventually, if it's not contained, leads to cancer. It causes tumors, and then it leads to cancer. And something that I have heard from conventional medicine is that all the organs are exposed to cancer except the heart.
Okay.
But in my findings in her case, the hyperplasia, even though it was not cancerous yet, but she had the swelling up of the myocardium, which if I had not treated and I had not contained it, it would have eventually led to sarcoma, which is a tissue cancer. But
of the heart.
Of the heart. Okay. And yet, in conventional medicine, a heart can never have cancer. Okay. So sarcoma is cancer, is tissue cancer. So that was the first discovery that I picked up, which negated what the understanding said. Okay. Secondly, so when I treated her, I focused on the heart, but I also treated the lungs, but I focused on the heart. So the treatment, my protocols worked on that heart, contained that hyperplasia, shrunk that tissue swelling, and helped that heart to run while I was repairing the tissue damage, because when lungs are not getting enough oxygen, they will also have those issues. And I treated her where she totally regained her ability to breathe on her own and returned those. But this is the part that I want to touch on. When she went to her pulmonologist, he could not believe that it was her, because he knew and he said, she was saying to me, he just could not believe. And he said, it has never happened. It has never been precedented. So he sent her for some tests to go and double check that those lungs were not scarred anymore, the breathing, the rheumatologist, and he sent her to all the tests, and all the tests came saying, sharp, 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 sharp. And then he said, I've got to write a paper. Because that's
as a
how
Herald newspaper or just a documentation?
I mean, doctors or scientists, they write papers when they want to discuss about a subject. Okay, so he was going to write a paper on the subject to which would give him a lot of recognition, because he was now coming up with something that had never been done in the history of medicine, in the history of pulmonologists.
So sorry, Tim, am I getting you correct? You're talking paper as in something like a thesis?
Yeah, something like that. Not a thesis, but something in that line. Yeah. He was going to do that. And then she had not told him, up to that point, she had not told him that the medication that she was using was mine. She had stopped his months ago. Okay. And then that's what happened. So she said, so he was already working on writing a paper that would give him a lot of recognition because of what he had achieved. And then she hit him with, no, I stopped taking your medication months ago. I'm using this lady's protocols. And then she said, he turned red, because this was a white person, the way he blushed. And he ended up sending her to do tests again, to go back to those tests, because he was now like, no, it's not possible. And then she phoned me. She said, must I go for those tests? Because I don't want those tests coming back being something else. I said, no, go. There are ethics in medicine as well. So she went, and the tests came being the same. And then he said, whatever she has done, it's amazing. But that is as far as it goes for us. This is something that qualifies for recognition, for a paper in conventional medicine. That's what. But in us,
there's nothing to be. Yeah.
Because that's not what we are on about. But at the same time, having said that, I also, for purposes of not gaining recognition, but for purposes of passing on information from generations.
And maybe changing the health.
The attitude, yes. And so that's
okay. So this in this instant, we're talking. There's a possibility of changing history in the health sector, if we can really get into it. And I'm just curious that let's go back to multiple endocrine neoplasia. When you diagnose a client with that, and you give this terminology that, like I said, is a can't get, don't you think it would be, for future generations, it would be a great opportunity for you to actually showcase the abilities of the alternative sector through the gift, the intuition, and everything that you've got, and actually set start a new health system that is changing the future of health. And you've been given that opportunity to do that. The resources you've got, the gift you've got.
No, actually, I don't think it's my call at this stage. My call at this stage is to help and treat people, because that's the agency. That's the part that's urgent. The documenting of the information, that's, that's secondary. Okay. At this stage, people are desperate to get help. They're suffering. They don't know what's going on with their health. They've been to every door, and they're still sitting with these problems. So that's my call. And also my other call at this stage, if the doors would be opened, would be for collaboration between conventional and alternative. Because I think I'm actually an epitome of that collaboration. Because I can tap on conventional, I can tap on alternative. That's what I'm representing already, to show that it works. It works. Because all these terms that I'm using, they are not alternative terms. They are conventional terms. But they describe the illness. The illness is there irrespective of what name you give it. But for purposes of making people know, this is what because that's how the system is constituted. It has to have a name, it has to have a label, and it's already labeled by conventional. So I don't have problems using those labels. But then I go to their archives and I go to that drawer and I say, this is what it is. But I'm coming as an alternative, but I know exactly in their archives, this is what belongs where. So I go straight to that drawer and I say, boom, this is what it is. So all I'm saying is, I am the epitome of collaboration of these two legs of health. And I'm also the epitome of diagnosis and treatment, because that's what constitutes health. Besides alternative and conventional, there's also diagnosis and treatment.
Yeah.
And there are areas where alternative cannot even touch. That is emergency medicine. Once a person is stabbed and is bleeding like crazy, alternative can never fix that. You've broken a leg, alternative can never save that leg if it's. But when it comes to conditions, to chronic conditions, to alternative, that's where it comes. That's where we come in. So all I'm saying is the need. Maybe I've just kickstarted the attitude and the of conventional, because that's where the problem is, not from us, it's from them. So maybe I've kickstarted, maybe this might start setting the ball into motion to say, maybe we should really look into that. And I promise you, you can imagine the milestones we'll reach if we were to work together. Let's go for a break, and when we come back, we get back to our topic. Life and death are created and controlled by God, so is nature. Nature, therefore, provides all the healing properties necessary to service mankind. Even scientists are students of nature. In the chaos of coronavirus pandemic, nature has provided us with mystical rose oil. This oil is a combination of specially selected and blended essential oils like clove, eucalyptus, rosemary, and many more. The special selection and the skillful blending process gives a finished product of remarkable protection from coronavirus. You have tried everything to protect yourself, right? It's time you try mystical rose oil, the miraculous gift of nature. Welcome back. We are on a hot debate here about how we craft the future of health, conventional and alternative. But let's get back to our topic.
Okay, let's talk MEN, men, as you call it. Can you give us the symptoms when you get the scan, and what do you see? What symptoms do you look at? And because I saw, according to the clip, it seems to affect from kids right through to adulthood, which is quite interesting.
Okay. Well, I'll talk about the symptoms in reference to the cases that I have treated. Okay, and I'll touch on, like the clip is saying, that it affects, it's ageless. It hits from child right up to adult. Now, the first case that I treated where I diagnosed this was a child, a school-going child. And the mother had come to me because the child was having problems with eyes. She had been to every kind of ophthalmologists and opticians and even all types of eye practitioners, and the child was battling. So that's why she brought it to me. Okay. Now you can look, if you look at that kind of condition, it's like, I mean, really, what are you going to do with the eyes? Because in eyes, it's you either to go to someone who's going to do spectacles, or what are you going to do with the eyes? Okay. So, and that is what I picked up in her case, that her eyes were getting serious condition. Now, the people that have got vision problems, now remember, like the clip is indicating that it causes a range of conditions depending on the type as well. But also I've seen some overlap of type 1 and type 2, which maybe I will touch on as a particular, maybe if I can make reference to the thyroid. That type 1 hits the thyroid, type 2 also causes problems with the thyroid, okay? So there are some overlaps between the two types. But now coming to this child, now remember, while there is this range of symptoms, it will not present as all these symptoms in one person. You'll find that person will have this type of condition, or will have two of these, or will have, but in her case, they brought her because she only had problems with eyes. And I picked up other problems, okay. Firstly, as you know that this is a genetic a problem, she actually inherited this from her mother. Okay, why am I saying this? Because when I shared with the mother that her eyes were because of that, and they would even complicate, because you find that eventually you find that even the eyelids, if you hear of people that where they say there's the eyelids, they've become thick, and the lashes tend to grow inside, you know, so it creates even complications, like, because remember, it creates tumor. So when that growth occurs in the eye, and then it messes up all that, it even, and you could even see when you look at her eyes, they looked bigger on the outside. Okay, they looked like, you know, bigger and smaller as you go. So they looked almost abnormal. When, I mean, not really abnormal, but almost, it's not your standard look of the eye structure, okay. But she also had another problem of the pheochromocytoma. Pheochromocytoma is an enlarged adrenal gland. So she also had that problem, which had not presented with symptoms yet, except the fluid retention, because she did have a fluid retention, and there was also a problem with her leg. I asked the mother if she sometimes complains about one leg, and the mother said, not really, but she liked to do these exercises that were, you know, jumping and karate and what have you. In a way, it was helping that leg not to present with the symptom, or they would think if maybe she feels a little bit of discomfort in the leg, it's because of the type of exercises that she was having. But then this is what happened when I shared with the mother, that it also causes a lot of infertility. And she said, in adults, you know. And she said, it explains, because I told her you were the carrier when she ended up explaining to me, because she said, hey, we battled to have this baby. She's the only child we have. She said, we tried everything, even in vitro fertilization. We tried, it didn't work. We tried everything. And she said, as you can see, I'm a bit oldish to have a child of this age. Because, and she said, when she was born, she was premature, she was sickly. We even thought she was never going to make it. Okay. So because infertility is also a big issue in people that have got this type of condition, okay, particularly with women. So she was therefore the carrier. And she said, that explains, okay. But now with the second one that I diagnosed, she was, this one was a young adult in her late 20s, 24, 25, I think, yeah. And she had an excruciating menstrual problems, but she said she had persistent abdominal pain, which just bothered her for as long as she can remember, okay. And it became worse with menstrual pains. I mean, when she's menstruating, it would be worse, but it was always there. Okay. But in her case, because of what we've seen in the clip, this condition causes it hits the endocrine system, it hits the glands. So in her case, it was hitting the pancreas. Okay, so that's where the abdominal pain was coming from. That's besides the menstrual cramps. Okay, so that's why she had persistent abdominal pain. It was because of the pancreas, and in her case, she had what we call glucagonoma. Okay, now glucagonoma is the hormone that enhances or increases sugar levels, while insulin decreases sugar levels. Glucagon increases, but now it was a growth, so she was pumping too much of glucagon, which would eventually make her become diabetic. She was not diabetic yet, but that's the road that she was leading, because it kept on elevating sugar levels, okay, which would end up becoming too much work for that insulin. So she was so that is what was causing the glucagon, the abdominal
pains.
But then this is the other thing that was interesting, because I asked her, because it was also affecting the thyroid, and asked the height, she said, yeah. She even thought she stresses easily, because those heart palpitations were just a common thing with her. And then I asked, do you sometimes find your tongue is heavy? A condition called glossitis. She says, yeah.
You said the tongue.
The tongue feels as though it has grown bigger. So even when you talk, you find you battling. She said, yeah. Sometimes I would have what we call, she would feel tongue tied. You know, when you try to pronounce, then you find the words are like gibberish, mixed up, and yet you talking normally. But then she said, because that it does that, it does that as well. So that was the situation in her case, because she also had this condition. So what I'm getting at, therefore, is that because we're running out of time, maybe I will not touch on the third and fourth cases. Maybe I'll leave third and fourth cases for
the next
show, yeah, because we won't be able to finish up and cover everything on this in this one, as we are already running out of time. So in a nutshell, therefore, so my abilities made me pick up what was going on there. Okay, but maybe the next that maybe I need to clarify is, how do I treat something that is a genetic problem? Okay, because remember, when it is a gene, am I in a position to fix the gene? No, I don't. I'm not in a position to fix the gene, but I'm in a position to chase that gene and see, you're causing damage here. I cannot stop you. You're a loose cannon. So you run wherever you want, but I'm going to run after you and say, okay, you've got damage, you've caused damage there, and I fix it. You've caused growth in the pancreas, and I shrink, because we've got protocols that do that. You've got the thyroid that's racing. We've got protocols that will tame it. Or if the thyroid is very inactive, we've got protocols that would elevate the performance, okay, improve the performance. So when we come back after the break, I'll talk more about how I deal with situations like this and how I've treated him. Let's go for a quick break.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
Welcome back. We are now touching on how I treat this type of condition, where it's regarded as almost impossible to treat it because it's a genetic defect. So let's go. Let's continue on that. Okay.
Okay, so you were touching on your case of the young adult that you were treating with menstrual pains, which hit the pancreas, etc., etc. When we're talking genetics, you were explaining that you can actually fix the genes. You can't fix the genes, but you can fix the causes
Yes.
of the genetic
No, I can't fix the causes of the genetic. I can fix the damage caused
by the
genetic defect.
Okay, just out of curiosity, Tembi, in a case like this, when you fix that specific area in the body, does the genetic aspect continue to do more damage, or once you fix that area, then you move on? You're done with that area. It's sorted out. It's functioning well, and you know that that aspect of the body now is fixed. How does it work? I'm just trying to make sense.
Okay, I cannot fix the gene. I definitely cannot fix the gene, but there are certain cases where I've tampered with the with the genetic aspect of it. Like, for instance, cases of sickle cell syndrome. Okay. Now, sickle cell syndrome is still a condition that is caused by a genetic defect. But what it does is you find a person is born with some of the red blood cells as they're supposed. Now, the normal shape of a red blood cell is disc shape. So now, as you can, when they move in the blood, we'll even show the viewers how they move in the blood. But now, when you've got a sickle cell, it's when you've got some cells that are not closed up. They're like a sickle. That's why they're called sickle cell. They're like this. They're standing like this. So they're not closed, and as a result, when the movement, the side that is closed is pulling the side that is open. So what happens is that when it touches the wall of the blood, then it causes an obstruction and it creates a lot of pain. It depending on where the wall is touched. If it's stuck in the chest area, it will cause shortness of breath. They say the asthma. If it is in the brain, it will actually cause stroke. I've had a client, a 13-year-old who's had stroke 3 times. By the time they brought it to me, she had already had, and she even lost her speech because of sickle cell. Because remember, when it touches the blood vessel, it obstructs the blood flow. So which is what causes the stroke in the case of a brain. So, but now because we work on these stem cells, then you find we have turned around cases that were like hopeless. Okay, both in terms of anemia and also in terms of the symptoms that sickle cells would create when they touch the wall. So what I'm getting at therefore is that this is just one case, but most cases where the problem is a genetic defect, I cannot fix. I just cannot fix a defective gene. But I can fix the damage that it causes. Like I said before we went for a break, that I know it's a loose cannon, it will cause a problem then we fix the damage, then it goes there, then we go right after. Okay, it does damage, then we fix there. And then maybe we relax. I always tell people that, okay, maybe we relax, the symptoms are gone, then you find, then maybe a year or 2 down the line, there the symptoms come back again. Because it has started, the loose cannon has started its nonsense again. Or you might find a case where you fix, then you find it never caused the problems. It's sorted. You can't really tell when and how because it's got the mind of its own. Okay.
But is this genetic?
Yes, this is a genetic problem. Okay. So at this stage, therefore, we don't have anything that fixes the genes. Okay, even though voltage, the topic that is showing signs that there can be, we can tamper in that area as well. Why? Because voltage treatment focuses on new cell generation. Okay, so where you can form a new cell, you can recreate because remember those defects end up like this pancreas where you find it goes crazy, or this thyroid. So, but now when you're in a position to sort out the voltage of that area, and then cell generation, new cells are made, old ones give way, then you find maybe you can, but there is already something that is saying there's that possibility but then these practitioners are still working on that. Okay, but as it stands, we cannot fix that. We cannot fix the genes, but I've treated a lot of people who have got symptoms that are triggered by these defects, genetic defects, but then you find I will be able, I can actually turn them around.
I think that's it, Thembi.
Thank you for watching, and keep sending those questions, keep making those comments, and keep praying for me as you have promised. And thank you for watching. Goodbye.